Hi, my name is Portia Hill. I'm a registered nurse. I've been a registered nurse for about 2 years. Today I'm here to talk to other nurses how to care for the Indian culture and how to be culturally competent within their culture. Well, I'm going to just start out by saying we all begin the process of learning the behaviors and beliefs of our culture at birth. Our culture can have a definite and profound effect on how we interact with others and also how we relate to the healthcare system. Diversity is prevalent in our society, and the patients and our coworkers in our healthcare system today clearly demonstrate that fact. Barriers to cultural sensitivity in the nursing profession can include stereotyping, discrimination, racism, and prejudice. There are situations in which we may portray a lack of sensitivity without realizing it or intending to offend someone else. Ways to promote respect is never make assumptions. I will say that again, never make assumptions. And I think us as humans, we do that a lot. We will assume things or we will prejudge people on how they look, how they talk, how they act, just different things, and I was always taught when I get ready to go in the room, I leave my brown bag at the door. Any kind of judgmental ways, I need to just leave that at the door, and I need to go in there and handle that individual as an individual. But yes, like I said, it's never make assumptions about individuals or their beliefs. Most importantly, make an effort to gain the patient trust for a stronger nurse-patient relationship. That's always a great thing. The best thing to do is try to gain trust with your patient, no matter what culture they are. Today, I will talk a little about the Indian culture. In this culture, their main food is rice, while the remainder is wheat, barley, maize, and millet. Their main religion is Hindu. Hindus eat any meat except beef or pork, whereas members of the higher caste and all Jains are normally vegetarians, with most even avoiding eggs. So they eat everything except for beef and pork and eggs. Hindus usually believe that a soul can have multiple reincarnations and that after the death of the body, a soul will be reassigned to another newborn or a human body or even an animal. This reassignment could be to the one of a higher caste. If the person did good in their life, in their previous life, then they will be assigned to a higher caste. If the person did bad, they feel like they will be assigned to a lower status body if the person did any kind of bad deeds. So I would guess that they would think that they won't be in a human or animal. I don't know what else could that person be in, but that's how they feel. And they feel real strongly about reincarnation. It is said that women must first obey her father, then her husband, and then she must obey her son. And that is different from other cultures. Us as adults, when we have a son, we expect our son to obey us. Well, not in the Indian culture. The woman will obey her father. Then once she gets married, she obeys her husband. Once she has a son, she obeys her son also. The opinion of the male head of household is especially important in the arrangement of marriages. India has a tradition of medical healing, teaching, and research that goes back more than 2,000 years ago. They depend primarily on non-invasive herbal treatments. Culture and religion plays a significant role in the course of illness for the Indian culture. In the Indian culture, family is very important. The role the role of the family should not be undervalued in this culture. So we as nurses need to keep that in mind also, that they feel very strongly about their family. Now, I know that we can't just go out and we can't just tell the family what's going on with that patient, but once we get permission from that patient, then yes, we could tell the family whatever the patient wants us to relay back to the family, because like I said, they are very tight-knit with their family. And the women during childbirth, the exact time of birth is very important to the family. Circumcision is uncommon. They may not want to name the newborn immediately, and they are strongly against abortions. They do not believe in abortions at all. Religion assumes a vital role during illness. People from most Indian religions are used to bathing every day, almost as part of their religious practices. The Indian concept of cleanliness is not satisfied by wiping or soaking, but has to be by bathing or washing in running water. And so, that may be a problem, because when they're in the hospital, the CNA or the nurse may just get a water basin and just kind of wipe you down in the bed. Well, they still believe that's just unclean, that they have to go to the tub or the shower daily. Colostomies and urinary catheters are difficult for patients of the Indian cultures. Their relatives, it's hard for them to accept urinary catheters or colostomy because they feel that it's unclean. And they pray to God a lot. They do that. The cultural competence may be defined as the ability to perform and obtain positive clinical outcomes in cross-cultural encounters. Respecting and being sensitive to people from diverse cultural and linguistic backgrounds is integral to the delivery of quality care. All health professionals must have a level of cultural competence when caring for people from different cultural backgrounds. It is imperative that in a culture like India, cultural competency is prioritized in medical and nursing education and healthcare. With that being said, the only thing I would say is, if you have someone of the Indian culture, you make sure you offer them a bath every day, and you will explain to them, that if they don't want a bed bath, and if they're able to get up out of the bed, to take them to the shower, to just maintain their religion and maintain their beliefs. And I think that's all about nursing, is to respect the individual. And whatever beliefs we have, we keep those beliefs to ourselves. Once we go in a patient's room or we're dealing with patient family members, we have to, like I said, set our beliefs to the side, and we have to do what the patient is asking us to do. Thank you again, and my name is Portia, and have a nice day.